Dr. Agbonile. I'm the medical director of the Federal Neuropsychiatric Hospital, Benin. We have two sites. It used to be known as Federal Neuropsychiatric Hospital, CMD, but because we have a permanent site now at Domina, we call it now Federal Neuropsychiatric Hospital, Benin.
So, sir, because of your special area in the health sector, so let's go straight into.
Well, we don't call it insanity, though, but mental illness, I'm sure that's what you know.
Okay.
It's an illness like others. So, but the word insane is considered pejorative within our circle, so we prefer not to use such words anymore. So, mental illness is a condition where the patient no longer tests reality as we know it. They may not be able to tell the difference between reality and fantasy, and then they have experiences that are a bit difficult for others to understand. Their perception is altered, their sense of interaction may therefore be altered. Belief system is also affected. When we say causes or cause of mental illness, we prefer to say risk factors, because mental illness has several risk factors. We can have those with origins in the inheritable part of our system. I'm choosing my words now so that the layman can follow me. Okay, so we have the genetic factors which can lead to mental illness. We also have the non-genetic factors, so to speak, social factors, psychological factors, and then of course physical illnesses can also lead to mental illness. Physical illnesses, that especially those that affect the brain. So if we take each category, then you'll find that illnesses like even cerebral malaria that affects the brain, encephalitis, any illness that leads to injury of the brain, physical injuries. For example, somebody has an accident with brain injury, somebody experiences meningitis, encephalitis, any of those things that gives you high fever, which eventually leads, that can also envelop the brain. All those things can. One consequence is that you may have somebody developing a mental illness.
Really?
Yes. Then you can also have other illnesses of the body, which may now, even infections. For example, HIV has a predilection for two major systems, the hematological system, which is the blood system, and then of course the brain, the nervous system. So HIV can actually manifest first in the nervous system before you realize that this patient has HIV infection, AIDS. So you can have viral infections, bacterial infections, and other infections which can lead to mental illness, because they've also affected the nervous system and then leading to certain manifestations. You can have mental illness also resulting from the use of substances like hard drugs, cocaine, heroin, our Indian hemp, and even some of these ones they are using this tramadol and the like. So you can also have that precipitating mental illness. I also mentioned that there are social factors that can lead to mental illness, especially when you look at a situation that can lead to stress. Anything that will increase stress in the society may become a risk factor for mental illness. For example, the current state in our country of insecurity, where people are always in a constant state of apprehension and fear, anxiety builds up, and this places people under tremendous stress, and it can combine with all those other factors that I mentioned to give you a scenario of the breakdown with a mental illness. So, social factor. Then, of course, the makeup of the individual, the psychological makeup of the individual. Remember that the stress we have, a lot of people are going through it, but not all of them end up with mental illness, which means the constitution of the person also contributes, which means there are those who are more vulnerable than others. And that is why I also mentioned earlier on that the genetic makeup of the person. Now, but we don't say that you inherit mental illness. What you do is you inherit the vulnerability to mental illness, right? So we can't say, oh, the mental illness is because the father was mentally ill or the mother was mentally ill. Because you will see that somebody who's mentally ill may have 5 kids, and only 1 or 2 will eventually also develop a mental illness, or none at all. And then again, you have somebody whose parents or relation normally for a week or 2 or 3 weeks. You can't compare that to someone who has been acting abnormally for 3 years, 4 years. Two different. Yeah, apart from schizophrenia, we have other conditions. You can have a manic patient, have a severe depressive patient. So they also have different durations. Just like in physical treatment, somebody that has a fracture, the duration of treatment in hospital is different from somebody that has malaria or bruise. Or a bruise. A bruise, exactly. Or somebody that has a cut with just stitch. She can even go home same day. But if you have a fracture, you are most, as an adult, you are most likely going to be in hospital for at least for several weeks, if not 1 to 3 months. So extreme anger, yes, maybe, but not anger. Everyone, we are susceptible to anger. And that's why, the last time you asked the question, I said, mental illness perhaps is on the spectrum. You remember? On one end of the spectrum, we say we are normal. On the other end, we say the person is abnormal. But then it's subjective, because at times we behave in a way that will be as extreme as the person who is abnormal. But is it sustained? No. Is it something that happens once in a blue moon? Yes. We may say, well, the man lost his school. That's the English we use to embellish it. And whereas, if a known person with a mental illness, anger is a normal emotional expression under certain circumstances. However, if an individual exhibits extreme anger and acts on the anger in such a way that is not appropriate for the societal rules, and people still don't seem to have enough information about what mental illnesses are, they tend to spiritualize it, they tend to say it's a spiritual thing, and then there's a lot of stigma, and the stigma is not restricted only to the patient. And if yes, what is the amount? These are issues. Okay, because people don't even remember there's mental health service to be rendered. So these are some of the things we have to deal with as challenges. Resources is very, and then dearth of professionals. The brain drain is really dealing with us. So it's a specialized area, it's a stigmatized area, not everybody wants to go into it, and then they find a lot of things. Well, to maintain good mental health, you need to take all the risk factors into consideration. Of course, we have to guard against right from childhood. By the way, injuries to the head is even worse when it happens in childhood, adolescence, when the child is still growing, because the brain is still growing. So any injury is going to be magnified, quote, as the child grows up. So you want to guard against such things. So children should guard it, and of course, the use of drugs should be something that we should not indulge in, because that is high risk. Especially also for a lot of people that are not using for a long time, no problem. Yeah, that's what, depending on the size of the bottle, the duration of fill-up will also be different. That you have been taking drugs for 30 years and you didn't break down doesn't mean that if I take the drugs for 10 years, I won't break down. And that someone took it for even his lifetime, it didn't break down, doesn't mean that another person will not take. Some people take it the first time, they have problems. So I told you that our constitution, our genetic makeup also, then our milieu, social and psychological milieu, the environment also matters. So all these things add up. So if your constitution and your social psychological milieu is different from mine, and then maybe your social psychological milieu is protective, mine may not be. So if I do what you do, I may break down, whilst you may not break down, or vice versa. So that's why you want to avoid such things. So you want to live a relatively good life where you have work-life balance with your church, your mosque, you have friends, you are able to, after you work, you have time to unwind, you exercise, so that you tune up your body. So those are the things. Then you avoid all the risk factors that you can avoid. The hardware is the infrastructure. So the software is the personnel.
Yes.
The
Okay.
people.
Okay.
And it is the people that makes anything happen. So if you want to have good services, then you must have good people. How do you have good people? You have to make them good, because I believe inherently people are good.
Train them.
You train them, you motivate them. Now, we have a trained workforce. Don't forget, they are professionals, they are non-professionals. So if they are professionals, they have been trained. So that's what they need. I also not so available, but we are managing it, we are scraping it, we are doing what we can to ensure that we balance things, and so by the grace of God we do more.
So yes, I don't want to pull your legs more, but because you don't want to talk about the past.
No, I don't want to talk about the past. I'm an optimist.
Right, okay.
So I will never talk about, I'd rather we talk about the future.
So
we'll talk
you
about
have answered the area of resources together with the other question.
Yes.
Yes. We just
So I'm sure perhaps the past, the only thing I would say about the past, maybe there were resource constraints, and so my predecessor couldn't do what he wanted.
corruption.
Corruption?
They're not corruption.
I'm not aware of that.
So now the spirit of work going on.
Not just go out there and pick people from the streets and bring them here. There are laws that so there has to be some government institutional support, and that's why I told you that the state government had a committee.
Yes.
So their job is to pick these people from the
So I'm
streets,
saying that
archive them.
Are you calling them out now? Are you?
Oh yes, because it's embarrassing when you see a lot of destitutes lining the streets.
Yes.
You know, it's not the job of the hospital to go out there and pick them off the streets. It's our job, however, to treat them when they are brought here. So what we will be calling for, and we are asking for the assistance of the state government, local government, to help us get these destitutes and also fund their treatment, because there's no budget line for patients who are destitute. Self-esteem, because self-esteem is a key factor in mental well-being. Okay. So somebody with a low self-esteem is more likely to get into mental illness than somebody with a good one. So when you build up their esteem, their self-confidence, they have a vocation, they have skills, they have social skills, they have professional skills, then they can earn a living. So some of them don't have also
mental balance.
They have the mental balance, then they have a place. So it's usually called halfway home, because there they can stay like a boarding. So these are some of the things
like
we have
the two production centers.
Exactly. So in fact you can even do internship there.
Right. Okay. Yeah. Last time, sir, you mentioned about rendering or accentuating the general medical practice services.
Yes.
I think the public are seriously waiting for.
We've already started it.
Yeah, that is why I use the word maybe.
Accentuating. Yes, we have currently we have about 12 beds for general medical cases that are not mental illnesses.
Yes.
You know, I mentioned something earlier about in order to combat stigma, the discrimination of mentally ill, that one of the strategies to integrate mental illness into general medical care or into primary health care even. So, and that's what we have done. In fact, we have an immunization center. We immunize about, on the average, about 400 plus babies every month. We've been doing that for a couple of years. And we have a medical center which started as a staff clinic, and then an NHIS center, but now it's a full-blown medical where we have inpatient, outpatient. We won't do minor
So somebody
surgeries.
have malaria and I can come.
Yes. If you go there now, we have somebody on admission. We have people on admission. So you see the signboard says General Medical Center stroke NHIS. So we even have nurses with that background there. There's a special intervention for that government is, providing almost those places. So we intend to use the opportunity to beef up our laboratories, to have a very good intensive care unit, then bring in other equipment that we require, which will boost our IGR. example, ultrasound scan machines, standard X-ray. We have an X-ray machine, but we need another one that's digital. Then
do you have a PCRO machine, sir?
that's part of what we are aiming to get. So, with this intervention from the government transmissions to yes.
So lastly, sir, the digitalization of assessing your services.
You mean online?
Yes.
Okay. Oh, we have a website, a very functional website with dedicated officers. So we have a lot of people now from all over the world sending us messages asking about this and that. We have interactions. We have very active email. You know, a lot of the problem with a lot of organizations, including government organizations, some is that you may send an email, no response. We have somebody who responds, a dedicated officer. Then we just uploaded 2-3 days ago a question and answer FAQ for patients, because we noticed that there were recurring questions they keep sending to us either on social media or on our email. So I asked the officers in charge to do a compilation and then liaise with the clinical services department, doctors, to look at them and refer ready-made answer in an FAQ format so that people can access it online. Then during the COVID-19 lockdown and afterwards, we had telemedicine sessions because we were drafted in by the state government, or the state government, to handle the psychosocial aspect of those patients who were in isolation center.
Quite resist.
Thank you.